In my first year of medical school, I was in an accident and lost my hand. My goal was to become a surgeon, and so I realized I was not going to be able to do that. A very kind physician who had taken care of me said, "Why don't you think about physical medicine and rehabilitation?" And I said, that makes a lot of sense. I came to the United States 32 years ago after completing my medical school training, and I came to train in physical medicine and rehabilitation as a specialist in a combined program between Temple University and Moss Rehab. I became involved basically with biomechanics, robotics, and prosthetic devices. As a result of that, I've helped develop a series of instruments that analyze how people walk, that help people walk, and for those that have had an amputation of either a leg or an arm, allow them to provide devices that help them function at their highest level possible. A fine example of that is an exoskeleton called ReWalk, which was developed by an engineer in Israel, and we were able to provide some of the software improvements to make it walk naturally. Our patients who have had spinal cord injuries are able to walk independently without having to rely on someone else for their mobility, who can get out of a wheelchair, who can really stand eye to eye with anybody else. I chose Moss Rehab Amputee Rehabilitation Fund in part because that's an area in which I've focused a lot of my effort over the years, but also because I've seen what individuals, once they receive an artificial limb, can do. The fact that we can help an individual do more of what they want, return to do what they used to do, that's a fantastic pleasure.